Hi everyone. Am I audible and visible? Yes, guys. Are you there? Audio video is it clear? Yes. Good evening, Malini. How was your physiology? Any repeats from our classes? Any repeats from last minute classes? So in RS6 and RS5, 95% of the total question asked are directly from the offline notes and offline materials and the grant test. Okay, and in RS7 also there were many repeats, more than 75 repeats from our offline classes. Okay, Riger-Mortis scheme, that's fine. Riger-Mortis scheme, that's okay. Then yes, Charan, are you there? Charan and others. So let's start in 1 or 2 minutes. Biochemistry 1. Yes, Neha, good evening. Good evening. Yes, RS6, the main question about antrapituitary, the hormone secreted by antrapituitary and the growth hormone. So that is very important question, growth hormone. Then the pain, I think we discussed in our classes, pain pathway. Then hyperthyroidism. Repeat. Muscle contraction. Spermatogenesis, repeat from anatomy classes. Visual pathway, middle ear, RAS pathway, muscle spindle. Okay, cretinism, taste pathway, occipits. So functions of CSF, cerebellar ataxia. All are repeat question from our offline classes. And for regular batch, RS7 batch, Babinski sign. Okay, Babinski sign was the question. So we discussed in our classes Babinski sign. Then 5 markers you can see: sarcomere, visual pathway, calcium balance, middle ear, phases of menstrual cycle, Addison's disease, Cushing syndrome and Addison's disease, commonly asked. We discussed in classes. I hope you remember that. Glucocorticoids. Okay. So most of them are repeats. Sharp pain, A delta fibers. Yes, many repeat addition disease. That's all okay. Yes, guys, audio video is clear. Shall we start? Shall we start? So yes, say yes in the group. All of you say yes. So we are going to start Biochemistry 1. So the most important topics in biochemistry, distribution of topics in upcoming exam. Yes, Malin. Yes, we are going to start now. So let's start with the distribution of topics in biochemistry paper 1. Cell and subcellular organelles, around 5 mark. The functions of ribosomes, functions of lysosomes, all this. Enzymes, definition of enzyme, classification of enzyme, properties of enzyme, competitive inhibition, non-competitive inhibition, very commonly asked, around 10 mark, around 10. Carbohydrate chemistry, carbohydrate metabolism, 15. Lipid chemistry, lipid metabolism, 15. So carbohydrate and lipid in paper 1, the protein in paper 2. Integration, 2 mark. Biological oxidation, 5 mark. Vitamins and minerals and nutrition, around 28. So you need to start with the minerals, vitamins and nutrition. You need to complete in 2 hours. That carry around 28 mark. 28. 28. Then acid-base balance, 10. So some commonly asked question in exam, metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. 4 important questions. Water and electrolyte balance, 2 mark. Extracellular matrix, around 3. ATCOM, that is 5. So this is the blueprint given by RGUHS. RGUHS. Chalo, now let's start. So let's start the question number 1. The main question. So this is one very important question. All of you go through this and try to answer. A 10-year-old boy with a poor nutritional intake was brought to ophthalmology OPD with a history of difficulty in vision. Difficulty in vision. So go through this and try to answer. Difficulty in vision. Especially in dim light. Incidentally, the examination, he had few lesions of the skin. A provisional diagnosis of certain vitamin is made. So what is that fat soluble vitamin deficiency? What is the RDA? Explain Wald visual cycle and any other 2 functions of vitamin. One of the simplest question, 10 plus 2 question. So this is basically vitamin A. Vitamin A. And this is xerophthalmia. So diagnosis is xerophthalmia. Xerophthalmia, nothing but vitamin A deficiency. So there are different stages of xerophthalmia. So XN, X1A, X1B, X2, X3B, A and XF and all. And XS also. So this you need to write in the exam. Yes, Swami Vivekananda and NEET Online. Thank you all. Charan, so what is the answer for this? Okay, very good. So what is the RDA? Can anyone answer what is the RDA? RDA. 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 Malini is telling sir around 1000 microgram. Yes, 900 to 1000 microgram. That is the answer. So you need to write about what are the sources. Sources. You can see here fruits. Any yellow colored, colorful fruits basically consist of vitamin A. Okay. So you need to write about the sources in exam. Sweet potato, spinach, carrot, my favorite, carrot, broccoli, pepper, yellow and green pepper, eggs, cheese, apricots, all these are basically vitamin A containing. So deficiency causes night blindness. It also can lead to diarrhea and also lead to anemia, and so all these are causes, basically the causes. Recommended, you can see here 900, and you can write the age group as well. So 1 to 3 years 300, 9 to 13 years around 600, especially in male. So female also almost same only. So yes, and in exam you can write about hypervitaminosis. Okay, so that is also commonly asked in the exam. Xerophthalmia, correct answer. Yes. Then as usual, Wald visual cycle, label diagram, very important. So this is given by George Wald, and you need to write the same diagram in the exam. So what happens in the retinal epithelium? So what happens in the blood? What happens in the liver? Yes, can you able to write, Charan? Can you able to write this diagram properly in exam? Label diagram important. Charan, Malini, I'm not going to discuss about this. You just memorize Wald visual cycle, basic 10+2 topic. Don't do mistake in that. Properly write. What are the sources? What is the RDA in males and females and the age group? Hypervitaminosis. Then you can write about Wald visual cycle, label diagram. Label diagram. This is very, very important. Then, if you want more marks in exam, you can write about stages of xerophthalmia. So what is the stage of xerophthalmia? So that you can write in the exam like this. So WHO grading of xerophthalmia, XN night blindness in dim light. 1A conjunctival xerosis, conjunctival dryness. 1B Bitot spot, the whitish spots over the sclera. X2 corneal xerosis, corneal dryness. 3A basically corneal ulceration or softening of the cornea. We call it as Keratomalacia. If it involves less than 1/3, X3A. Involves more than 1/3, then it is X3B. When there is a scar is there, then you can write corneal scar, XS. Retina involved, fundus involved, then it is XF. So this is very, very important. Very, very important, guys. Yes, Malini, can you just memorize this? Can just memorize? Malini, Charan, Swami Vivekananda, Prashant, NEET online. Can you able to memorize this? Can you able to write this? On Monday's exam, tomorrow holiday, day after tomorrow holiday, 48 hours time is there. You can prepare. Lot of time is there. Yes, Malini, good. Chalo, now a question for you. Now look at this. What is this clinical presentation? You can see here the white color spot over the sclera, which has some gas bubble like appearance because of Corynebacteria. What is this and what is the grading? What is this and what is the grading? Try. Malini, very good. Sir, this is Bitot spot. Bitot spot. What is the grading? X1B. So B for Bitot, B for B. Bitot spot. Good. Chalo, next. Now look at this. One more child with a history of vitamin E deficiency. What we can see here, softening of the cornea, dryness of the cornea, involving more than 1/3 of the cornea. You know, cornea has 5 layers. More than 1/3 of cornea is involved here. What is this basically? It is a medical emergency. Yes, come on. What is this basically? Come on, guys. Try. Corneal ulceration. Yes, this is known as Keratomalacia. 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 Good. Chalo. Next question. Write the steps in beta-oxidation of palmitic acid. Explain the energetics of the pathway. Energetics. How much is the energy produced by palmitic acid or 17C fatty acid? Where it is going to take place? Why is it known as beta-oxidation? Why not alpha-oxidation? What is Refsum disease? What are the 4 steps? You need to write properly in the exam. What are the 4 steps? What are 4 important steps? Yes, Charan, we discussed many times in offline classes. 4 important steps. (106), good. 106, good. Dora. Great. Chalo. 4 steps. Jaldi batao. 4 steps. Yes, 106, good answer. 106 ATP. So given by Malini. Great. OHOC. Acha, OHOC. What is that OHOC? Oxidation, hydration, oxidation, and lyolysis. Right? So yes, good answer. Oxidation, hydration, yes, very good, Charan. Excellent answer. So this is what you need to write in the exam. Acyl CoA becomes trans-acyl CoA. That become hydroxyacyl CoA, ketoacyl CoA, then become acetyl CoA and acyl CoA. The 4 steps you can remember. Dehydrogenation. Step 1, hydration. Step 2, dehydrogenation. Step 3, cleavage. 4 important steps. So it's a basic answer you need to write in the exam. 4 steps. Chalo. Now the energy, it is 106 ATP as per new concept. The old concept, 129 ATP. When we used to study 129, now it is 106. 17C fatty acids. So 17C fatty acid, all of you write. 17C fatty acids is equal to 101 ATP. 101 ATP. So write this in chat box. Write this in chat box. Good. Chalo. Next, I have one interesting Viva question, okay? Very important Viva question. You know, this is the question asked by my teacher around 15-20 years back. So the question is about the patient is having retinitis pigmentosa, cerebellar ataxia, polyneuropathy, and it is because of deficiency of phytanol CoA hydroxylase. There will be accumulation of phytanic acid. What is this condition known as? Can anyone tell me? This was the question asked by one of the teacher during my Viva day. I remember the enzyme deficiency and accumulation of phytanic acid. Yes, come on, Sharan, Malini. What is this condition? This is very important. This can be clinical based question. Identify the condition. Let's see. I'm waiting for the answer. Waiting for the answer from the students. It's an interactive session. It is not a regular lecture. It is just an interactive session just to help you what to write, what not to write and all. Very good. Sahil. Refsum disease. He said, sir, Refsum disease. Refsum disease. Great answer. Good. Alpha oxidation is affected. That's great. Okay, Tejas. Thank you. Chalo. Next question. We are going to talk about Refsum disease. We discussed already. My prediction, probably this is the question number 3. All of you go through this question. Try to answer. 8-year-old boy. Bacha, 8-year-old boy. Abnormal gait. Tenderness over tibia. Patient is having tenderness over tibia. Abnormal gait. Okay. Serum calcium 8.2. Serum calcium normally 9 to 11. It is less than that. Phosphate less than that. Serum vitamin D 3 only. It is only 3. Normally between 8 to 55. So it is only 3. What is the vitamin deficiency disorder here? What is the RDA of vitamin D? Explain the formation of calcitriol. So what happens in the liver? What happens in the kidney? What happens on exposure of sunlight? Describe the role of calcitriol in calcium homeostasis. Simple question. Basic concept in physiology as well. Calcium metabolism. Rickets, very good. So Charan, very good. So the answer is rickets. And in adults, the same question as 28-year-old. Then it is osteomalacia. Osteoporosis is common in old age. This is osteomalacia, softening of the bones because of the deficiency of the calcium. The calcium is very important for strength of the bone. Right. So this is basically, so Malini, what is the requirement? 1000, doraisylin 1000. So before that, what is the synthesis of vitamin D? UVB rays, not UVA, UVB. The skin, the epidermis basically. Exposure to 5 minutes every day. That is sufficient to produce vitamin D. So dehydrocholesterol. Again, question asked, what is the function of cholesterol? Vitamin D synthesis. It becomes vitamin D3, cholecalciferol. So that cholecalciferol in the liver and in brain pericytes, it converts into 25-hydroxy vitamin D3, 1-alpha hydroxylase that occurs in the kidney, glial cells and neuron, it becomes 125 known as calcitriol. So all of you remember, 1 is equal to kidney, 25 is equal to liver. This is what the area of confusion. So all of you write 1 is equal to kidney. Kidney is small, no 1. 25 is equal to liver. So write this in chat box. 25 hydroxylase occurs in the liver. 1 hydroxylase occurs in the kidney. Important confusion. Very important confusion. Okay, chalo. Keep writing this. Keep writing. Yes, Charan. Good. Chalo. Next. If you see what is the requirement in international units. So in adults, basically. So it is around 600 international units or 15 mcg. 15 mcg, that is also correct. So this is the table. You can write in the exam. So what is the requirement between 0 to 12 months, 1 to 13 years, 14 to 18 years. In adults, basically 600 international units or 15 mcg. So 900 in vitamin A, 600 here. Okay. Yes. So this is very, very important. Yes, Dora, very good. So this is area of confusion. International units 600 microgram, that is 15 mcg, that is in vitamin D. So now we have rickets. What are the clinical features of rickets? So mnemonic is also rickets. R for rachitic rosary, like a rosary bead appearance at the costochondral junction. Pigeon chest. Pigeon chest. Craniotopes, basically skull. Knock knee. Knock knee. Commonly involves end of long bone become wide, so there will be widening of the bone, especially wrist joint. Teeth eruption delayed. There can be teeth hypoplasia. Skull. Frontal bossing, delayed closure of fontanalis. So mnemonic, you can remember, all these are clinical features of rickets. Yes, Dora, can you able to write? Able to write the clinical features in exam? Mnemonic is rickets. Okay. Can take the screenshot, can save, you can share with the group as well. You can share, Charan, just take the screenshot and share with the group. Malini, as you also, just share with the group so that it can help many students, especially the mnemonics. Okay, now I have two questions for you. So, two questions for you. So, what is this condition? Look at this skull of a child and look at the skull bone, softened cranial vault because of calcium deficiency. What is this basically? Yes, come on, try. Try. Craniotapes, Sahil. So answer is correct. Craniotapes. Craniotapes. Look at this now. Like this. What is this condition known as? Come on, try. Try all of you. Knocked knee. Yes, very good. This is known as knock knee. Okay. Knocked knee. Good. Knock knees. Great. So that completes question number 3. So vitamin A, vitamin D, rickets, osteomalacia, and beta-oxidation, Refsum disease. Chalo, next question. A 25-year-old patient known as type 1 diabetes. Type 1 diabetes. Polyuria, polydipsia, polyphagia, retinopathy, neuropathy, nephropathy, right? Comatose. So patient is in coma. She was not taking insulin regularly. So he neglected the instruction from the doctor. He was not taking insulin properly. As you know, insulin is a drug of choice in type 1 diabetes mellitus. In type 2, basically oral hypoglycemic drugs. Biochemical analysis shows Blood sugar 510. See, 510 is the sugar level. Rothera test is positive. Rothera test is for ketone bodies. Acetic acid, esteoestic acid, beta hydroxybutyric acid. Benedict test is positive. So urine in the urine, Benedict test can be 3 marks question. Blood gas analysis shows pH 7.2. So it is basically acidosis. Bicarbonate is only 12. So what is the probable diagnosis? So this is the answer I wanted. What is this condition? What is this condition? And what are the compounds give Rothera test positive? What is the principle of Rothera test? Explain the steps in synthesis of utilization of these compounds. So this is basically ketogenesis. You need to write about the ketogenesis properly. So what is this? Yes, very good, Malini. So this is basically DKA. DKA. Diabetic ketoacidosis. Diabetic ketoacidosis. You know, Kussmaul breathing is common in case of DKA. Okay. So answer is ketone bodies. What are ketone bodies? So ketone bodies are acetate, esteoestic acid and beta-hydroxybutyric acid. The very important one is the acetoacetic acid. Rothera test is basically for this ketone bodies. So what is the color produced by Rothera test? What is the color produced by Rothera test? Come on, try. Pink ring, purple ring. Yes, purple ring is produced. Right? Rothera test. So just remember this, Rothera test. So we use ammonium hydroxide, urine and Rothera powder. So when you see purple ring, so all of you write Rothera is equal to purple. Purple. Again it is +1, +2 and +3. So basically for Rothera test, so +1, +2 and +3. So all of you write Rothera is equal to purple ring. Sure. Next. So in exam, you need to write about the Rothera test, properly about the Rothera test. Sodium nitroprusside, ammonium sulfide, and anhydrous sodium hydroxide. Okay. So what are the samples required? Sodium nitroprusside, ammonium sulfate, and anhydrous sodium bicarbonate. So all of you write this, all the 3 reagents of Rothera test. Write this in chat box. Keep writing. Keep writing, guys. Charan, keep writing. Malini, keep writing this. So let's go a little slow. Keep writing. So the advantage of live class is you can interact with the faculty. You can interact. You can just keep writing few points in the live chat. So that will help you to remember the concepts. Okay. Sodium nitroprusside, ammonium sulfate, anhydrous sodium carbonate. Good. That's okay. Now this is what the synthesis, the pathway of synthesis of ketone bodies, and you must know different enzymes. Thiolase is the enzyme. So free fatty acid becomes acyl-CoA. Acyl-CoA become acetyl-CoA. With the help of thiolase enzyme, it becomes acetoacetyl-CoA. With the help of HMG-CoA synthase, not the HMG-CoA reductase, hydroxyl beta methyl glutaryl-CoA. With the help of HMG-CoA lyase, it becomes acetoacetate. Acetoacetate become acetone, which gives a fruity smell in the breath. Then, with the help of enzyme dehydrogenase, it become hydroxybutyrate. So this is the pathway you need to remember. Okay, Charan, take the screenshot of this and revise. Take the screenshot and revise. Dora, very important concept. Very, very important concept. Chal. Next. Next question is about lipoproteins. Lipoproteins. Define lipoproteins. Mention the different lipoproteins. Explain the metabolism of dietary lipids under the following heading. Dietary lipids. One is assembly. Second one, transport. Third, utilization. The fourth, metabolic fate. Metabolic fate. So very important. So very, very important, guys. So here in this, you need to write about the types of lipoprotein. What are types of lipoprotein? As you know, chylomicrons. So chylomicrons are largest lipoprotein. So diameter is around 500. Where they are present? Intestine. So what is the function of chylomicron? Transport of dietary triglycerides. So what is the apolipoprotein present? Apolipoprotein A, B48, C1, 2, 3 and E lipoprotein. So this is very important. Then VLDL, diameter is 43, mainly produced in the liver. It is basically for transport of endogenously synthesized triglycerides. So again B100 present, C1, 2, 3 and E present. Then comes is your LDL. LDL is bad cholesterol, 22 is the diameter. So what is the function of this? Transport of cholesterol from the liver into the peripheral tissues. Into the peripheral tissues. So it helps in the formation of atherosclerosis, atheroma formation. Atheroma can lead to heart attack and it leads to sudden death. So this is B100. So I'll have to write in the chat box. LDL is equal to bad, and what is the lipoprotein present? B100. So write this in chat box. So LDL is bad, B100. B100. Keep writing. Then HDL, good cholesterol. The diameter is 8, smallest. The main function of HDL is transport of cholesterol from the peripheral tissues into the liver. So it is a good cholesterol. So what is present in that? C, 1, 2, 3 and D and E. So B for B100, that is a bad cholesterol. So write this, Charan. LDL is equal to bad, is equal to B100. Yes, Malini, Dora. So keep answering, keep writing. Are you there, all of you guys? Yes, Charan, right? LDL is equal to bad is equal to B100. B100 is apolipoprotein. Yes, great. That's great. Chalo. Next, you must know what is lipid profile. Lipid profile. What is normal cholesterol? What is normal triglyceride? HDL, LDL and all. This is also very important. You can take the screenshot. So normal cholesterol desirable. That means less than 200. Triacylglycerol less than 150. HDL, good cholesterol, should be 60 or more than 60. LDL cholesterol should be 60 to 130. Cholesterol HDL ratio should be 4. So this is desirable. And what is borderline? And what is high risk? So when cholesterol level more than 240, risk of stroke, risk of heart attack. Okay, so there can be stroke, there can be MI that leads to sudden death. So cholesterol is bad. Triglyceride should be less than 150. Anything more than 200 to 500, that is very bad. HDL less than 35. Again, it is bad condition. More than 160, LDL bad. So when it is 6 ratio, that is also bad. So this is very, very important lipid profile. Yes, Sharon? Sharon, okay? Getting my point? Getting my point? So after the exam, do every day running, fast running. Okay, fast running like this or fast walking every day. Do meditation, take less fat. Because nowadays heart attack is common in doctors because of the stress hormone, because of the extreme stress. So, okay guys, after the exam, you need to start some exercise. Agree with me, Charan? After exam, we will run. We will join some gym. We will do some workout. We'll keep our cholesterol less than 200. That is less than 200, target 200. Okay, so target 200, right? This. So our target is less than 200. What is less than 200? It is not 200 rupees. It is not 200 BP. It is less than 200 cholesterol. Yes, Sharon, write this. Our target is less than 200. Okay, that's great. Chalo. Now, in exam, if you want more mark, you can write about hyperlipidemia. Hyperlipidemia. There are different types are there. 1, 2, 2A, 2B, 3, 4 and 5. Very important MCQ commonly asked. If you want, you can take the screenshot. You can save. So whenever question asks lipoprotein, you can write about all the types. What is the function of lipoprotein? What are the apolipoproteins present? And what is good cholesterol? What is bad cholesterol? And what is borderline? What is desirable? And high risk. And also you can write about hyperlipidemia. Very, very important. Especially Malini and Charan. So try to memorize this. Whenever question asked lipoproteins, write this and come. Okay, you will get distinction mark. I'm telling you, if you write all this, you will get distinction. This is how I used to write in my exam. I used to get 70 plus in all theory, but less in practicals. Okay, so write this, memorize this. Okay? Yes, good. Chalo. Now I have a very interesting question for you. See, there's a question for you. There is a capsule here and there is a fish. We call it as fish oil. The fish oil is very good for health. That is prescribed in heart attack patient, stroke patient. So heart attack ಆದವರಿಗೆ ಈ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಕೊಡ್ತಾರೆ, ಕ್ಯಾಪ್ಸೂಲ್ ಕೊಡ್ತಾರೆ. My question is, what are essential fatty acids? Can anyone tell me what are essential fatty acids which are very good for the body? Come on guys, come on. Come on guys, come on. What is this? Fish. Salmon fish. All fish good, no? Basically. Huh? Anyone from Mangalore? Fish lovers. Ha, very good. Malini answering, sir. Linoleic acid. Linolenic acid. And arachidonic acid. Very good. Excellent answer. Excellent answer. Good. I'm going to write here all of you. Linoleic acid. Linoleic acid. Linolenic acid. And arachidonic acid. Arachidonic acid. All these are essential fatty acids. They are known as PUFA. Polyunsaturated fatty acids. Remember, saturated fatty acids are bad. Polyunsaturated fatty acids are very important. They prevent heart attack. They are also very important for development of your brain. So, okay, fish is good. Fish is good for the body. Yes, Charan, fish lover, good. That's great. Next, very important question, sixth question. Question asked in the RGUHS. Medical students who had an exam on the next day did not eat anything that previous night. Next day morning, he had severe headache. Very severe headache. Okay. Headache. Full of headache. Unable to write exam. And giddiness. And plasma glucose level is 48. 48. So, what is this condition? Interpret the plasma glucose level. 1 mark. Metabolic pathway which maintain blood glucose in fasting state. Second question. Third question. Metabolic pathway that synthesize glucose from pyruvate. Yes, come on. Okay, roti. No problem. Good only. Charan, what is this condition? Charan, ಏನು ಕಂಡೀಷನ್ ಇದು? ರಾತ್ರಿ ಫುಲ್ ಟೆನ್ಷನ್ ಅಲ್ಲಿ ಓದಿರ್ತಾರೆ, ಬೆಳಗ್ಗೆ ಹೋಗ್ತಾರೆ, ಓದ ತಕ್ಷಣ ಏನಿಲ್ಲ, ಫುಲ್ ಗಿಡಿನೆಸ್, ಹೆಡೇಕ್, ಫುಲ್ ಹೆಡೇಕ್, ಎಕ್ಸಾಮ್ ಬರೆಯಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ. ವಾಟ್ ಈಸ್ ದಿಸ್ ಕಂಡೀಷನ್ ಅಂಡ್ ವಾಟ್ ಈಸ್ that pathway going to occur in him? Yes, very good. Malini got the answer. That is hypoglycemia. Excellent answer. Hypoglycemia. So what is the pathway you need to write in the exam? Glycolysis or gluconeogenesis or glycogenolysis or glycogen synthesis? What is that? Come on, tell me. Tell me, guys. I will wait here till you answer. चलो दोस्तों, आंसर करो, जल्दी आंसर करो, ज्यादा टाइम नहीं है मेरे पास, थोड़ा सा टाइम है. कमान शरण, मालिनी, आर यू देयर? क्या लिखना आपको एग्जाम में? You need to write about gluconeogenesis, guys. Gluconeogenesis. 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 What are irreversible steps in gluconeogenesis? है ना? Phosphoenol pyruvate carboxykinase, fructose 1,6 bisphosphatase, and glucose 6 phosphatase. So very important. Okay, very important, guys. So we need glucose. That means glucose has to be synthesized. Our glycogen should be broken into multiple glucose particles. Gluconeogenesis. So what are reversible steps in gluconeogenesis? Very important. Look at this. So this is the very important table. All of you can take the screenshot of this. So on the one side you can see glycolysis. One side glycolysis, and the other side we have gluconeogenesis. So in exam you can write this and you can explain gluconeogenesis basically. So what are irreversible steps? One is your PEP carboxykinase, one important enzyme. Second, fructose 1,6 bisphosphatase. Third, glucose 6 phosphatase. So all of you write in the chat box. So 3 irreversible steps. One is glucose 6 phosphatase. Second, fructose 1,6 bisphosphatase. Third, PEP carboxykinase. So write this in chat box. Very important. Dora, Malini, keep writing these 3 points. Irreversible steps in gluconeogenesis. So glycolysis and gluconeogenesis both are same. Both have same reactions except these 3 reactions. Charan, okay. Now here one more clinical question. Muscle glycogen do not contribute to blood glucose level. Why? Because in muscle, glucose 6 phosphatase is absent. Very important question. Very commonly asked. Yes, good. Good answer, good. Okay, now the 7th question. A 10-year-old boy, beta hai, with a diagnosis of malaria. So malaria is there. The patient is having fever. Patient is having chills and rickets. So chills and rickets common in malaria, caused by malaria parasite, Plasmodium. On examination, malaria which is diagnosed, he was given with primaquine. So primaquine is given, chloroquine, primaquine, antipyretics given. Within 1 day, he found to develop hemolytic anemia. So after starting the treatment, he presented with hemolytic anemia, hemolysis, jaundice, hematuria, unconjugated hyperbilirubinemia. Name the pathway affected here. Name the compounds formed within this pathway. What is the relationship between primaquine and hemolytic anemia? So very important question. So we started primaquine here, 15 milligram. The patient presented with hemolytic anemia. So what is this? What is this? Anyone? What is this condition? Long essay. Come on, guys. Come on. You need to answer fast. Like a Bumrah. You need to answer like a Bumrah, guys. Bumrah. Accuracy important. Accuracy. Bumrah. Okay, very good. Charan, excellent answer. So this condition is G6PD deficiency. Very good answer. G6PD deficiency. So what is the pathway? HMP pathway. This is HMP pathway. So HMP pathway very important to produce NADPH. NADPH is very important for glutathione. Glutathione is antioxidant. When no antioxidant, the cells are going to die. Cells are undergoing free radical injury. That is known as hemolysis. Okay, this is basically G6PD HMP pathway. Good answer. Good. So all of you remember HMP pathway. It occurs in 3 locations. H for hepatic, M for mammary gland, and P for periphery. It occurs in periphery, especially in adrenal cortex. So all of you write in the chat box. HMP is equal to HMP. So HMP is equal to liver, mammary gland, and periphery, that is basically adrenal cortex. So this is very important. Location commonly asked. Then, what are 2 pathways of HMP shunt? So what are 2 pathways? Yes, come on guys, 2 pathways. What are 2 phases? We call it as oxidative and non-oxidative. Oxidative and non-oxidative. You need to write about 2 phases, very important. So the first phase is oxidative phase. In oxidative phase, important is glucose 6-phosphate dehydrogenase, phosphogluconolactonase, phosphogluconate dehydrogenase. 3 important enzymes. So the mnemonic is great people play. Great people play. So 3 important enzymes of oxidative phase. So all of you concentrate. So this is very, very important. HMP pathway. You can take the screenshot if you want. So this is the area you tend to mistake. Oxidative phase, non-oxidative phase. In oxidative, 3 important enzymes. The great people play. So mnemonic is great people play. 3 important enzymes. Charan, have you taken the screenshot? So 1 time listening, 1 time writing is equal to 10 time reading. So you will get a lot of information in ChatGPT, lot of information in Google, lot of information in book. So what is important is listening to class and interaction with the faculty. That will make you to remember. Okay. Great people play. So that's great. So this is oxidative phase. Then we have non-oxidative phase. So in non-oxidative phase is reversible. So it converts ribose 5-phosphate into other sugars. There are again 3 enzymes. Mnemonic is PPT-TT. So PowerPoint TT. So P for isomerase, that is pentose phosphate isomerase. Then epimerase, trans-ketolase, trans-aldolase, and also trans-ketolase we discussed already. So this is non-oxidative phase. In exam, there should be answer, sir, oxidative phase and non-oxidative phase in relation with HMP shunt. Very, very important. So then comes is G6PD. Very commonly asked G6PD. It is X-linked recessive condition. X-linked recessive condition. Remember, most of the enzyme deficiencies are autosomal recessive. G6PD is the one condition which is basically X-linked recessive. So all of you write in the chat box. So G6PD is equal to X-linked recessive, XR. So in case of G6PD, there will be formation of hinge bodies. Hinge bodies. So they are basically inclusion bodies within the RBC. They're composed of denatured hemoglobin because of the oxidative damage, and it commonly occurs in the spleen. So there will be hemolysis, results in Bitot cells. We call it as Bitot cells in pathology. So what happens actually? So glucose convert into glucose 6-phosphate. It convert into 6-phosphogluconate. So when this enzyme is absent, so there will be no NADPH. When there is no NADPH, so there is no glutathione. So when there is no glutathione, so there can be hemolytic anemia, there can be oxidative stress. So this is the very, very important question commonly asked. The question can be asked, name some antioxidant. One very important antioxidant is glutathione. For glutathione reactivation, we need NADPH. No NADPH, so there will be oxidative stress, there can be hemolytic anemia. So is it clear, guys? Is it clear? Come on, guys, is it clear? Have you taken the screenshot of the class? So Malini and others? Yes, took. Okay, fine. Chal. Next. So the next question is, describe cholesterol biosynthesis up to formation of mevalonate. Mevalonate. Explain regulation of cholesterol biosynthesis and hypercholesterolemia. What are two causes of hypercholesterolemia? So very important. So the cholesterol is very bad, I said in the class. The question is about synthesis of cholesterol. Can anyone tell me what is the rate limiting enzyme of cholesterol synthesis? Can anyone tell me what is rate limiting enzyme? Charan, Malini? Come on, try. Yes, very good. HMG-CoA reductase. And this enzyme is inhibited by statins. Statins. So they are commonly given in case of hypercholesterolemia. Okay, statins. Like example, atorvastatin, lovastatin, all is such statins. So one of the common side effect is myopathy. So they are given in case of cholesterol, hypercholesterolemia, or in case of any condition with so high levels of LDL cholesterol. Okay. Yes. So because when there is a more cholesterol, there is a high risk of that is stroke and high risk of heart attack. So then what are the stages? This is the very important diagram. This you need to write in the exam. So acetyl-CoA, As you know, it is a 2-carbon atom. Become ester-acetyl-CoA, aceto-acetyl-CoA. It become HMG-CoA with help of HMG-CoA synthase. With help of reductase, it become malonate. So malonate is 6C compound. 6C compound. So all of you write in the chat box. Malonate is equal to 6C compound. 6C compound. So this become isophentenyl pyrophosphate. Then finally it becomes saccharine, lanosterol and the cholesterol. So the cholesterol is very important for steroids, vitamin D synthesis and bile salts. Steroids, vitamin D and bile salt. So cholesterol is needed for many useful compounds in the body, especially bile salts, primary and secondary bile salts. Vitamin D to prevent rickets and osteomalacia. And steroids, which is basically the stress hormone secreted by the adrenal cortex, that is Cushing syndrome, Addison's disease. So these are important compounds synthesized from cholesterol. 6C compound. Good. Statins can be questioned, Malini. So upcoming exam, statins, what is the mechanism of giving statins in a condition of high hypercholesterol condition? Okay. So this is very important. You can take the screenshot of this and you need to memorize. Cholesterol biosynthesis. Charan, are you there? Charan, I think this is not discussed in regular offline class. So this is very important one. So probably this question can come tomorrow. You have to memorize this. Cholesterol biosynthesis. Are you there? Charan? Manthan, where are you? Are you there, Manthan? So the next question. So atorvastatin we discussed already. Then the question number 9 from acid-base balance. So all of you concentrate. Now we are into the next question. Manthan, are you there? Yes, Manthan. You have to memorize everything with every class. Yes, Manthan, are you there? Okay, good, Manthan. So now I have a question for you. A 50-year-old man, 50-year-old man having intestinal obstruction. So his intestine is obstructed, obstruction of intestine. So continuous gastric aspiration. So gastric aspiration, that is loss of HCl from the stomach, that is HCl. Following is the laboratory finding. Blood pH is 7.55. High. Normally is 7.45. It is 7.55. Bicarbonate is 45, but here it is 20 to 30. Bicarbonate is less. PCO2 is 60. Normally it is 35 to 45. So 140 sodium and potassium is 2.5. So there is a depletion of potassium in the cell. There is a hypokalemia as well. Hyperkalemia can lead to cardiac arrhythmias and death. So my question is very simple. What is this condition basically? Malini, is it respiratory or what is this? Is it respiratory or? See, patient came with a history of intestinal obstruction. It is not respiratory cause. It is basically metabolic cause. But there is a compensation in the lungs. What is this condition? So patient pH is going up. Okay, pH is going up because of more and more excretion of H+ ions. H+ ion maintain low pH. So more H+ ions are going out. What is this condition? So the cause is basically metabolic condition, and there is a compensated respiratory alkalosis. So here this is basically metabolic acidosis along with respiratory alkalosis. Okay, metabolic alkalosis with respiratory compensation is there. Okay. So this is basically metabolic alkalosis. So pH is raised, HCO3 is raised. Okay. PCO2 is almost normal. Look at the PCO2. PCO2 is also raised. Probably there is a compensation. So this is metabolic alkalosis. So you need to write about alkalosis in detail. What are the causes? What are compensatory mechanism? And normal pH, normal values of sodium, potassium, chloride and all. That is very commonly asked. Yes. Chalo. This is about the acid-base balance. Chalo. The Malini okay. Next heading is a 40-year-old Navy officer contacted his physician for development of bleeding gums. Loosening of the teeth problem, pain in the joint, poor wound healing. History revealed that he was in submarine for 40 days. 40 days. Name the vitamin deficiency. Name the disorder. Dietary sources. 4 biochemical functions. Biochemical basis of spongy bleeding gums. Yes, Manthan. Navy officer. Yes, Manthan, can you answer this? Navy officer, no limbu in submarine, no. So ocean, so not getting proper limbu. Citrus food is not there, only staple food. 40 days. What happens? Which vitamin deficiency? Vitamin D? No. Vitamin A? 40 days only 40 days. So basically this is, yes, this is basically scurvy. So answer is scurvy. Vitamin C deficiency. Vitamin C. So vitamin C is very important for collagen synthesis. So when there is no collagen, the weakened bone and all the bleeding gums and all occurs. So our body cannot synthesize vitamin C. That can be a reasoning question. Why our body is unable to produce vitamin C? Which enzyme is deficient in humans? Okay, that is also very commonly asked. Very good, Manthan, excellent answer. So answer is scurvy, vitamin C. Great. Okay, so this is about the question number 10. So you need to go through about the vitamin C in detail. I'm not going to discuss about it. So basically for collagen synthesis, so the steps of collagen synthesis and other functions of vitamin C. Vitamin C is also antioxidant. It is also basically for development of various organs and all. Vitamin C. Scurvy is the common disorder, right? Good. And the 11th question and the next 10 questions. So my prediction, there will be one question from the GACS, glycosaminoglycans. Second, all of you concentrate, electron transport chain and chemiosmotic theory. Very, very important. Chemiosmotic theory. You know electron transport chain, there are 4 complexes and ATP synthase and 2 mobile complexes, ubiquinone and coenzyme Q, I think, right? So you need to write about electron transport chain and inhibitors. What are inhibitors of 1, 2, 3, 4? What is chemiosmotic theory? You must know. Okay, what is uncoupling? That can be question about uncoupling as well. Uncoupling. Then BMR. So very, very important. Define BMR. What are the factors affecting BMR? What are the conditions of low BMR? What are the conditions of high BMR? Very important question. Then classification of enzymes. Classification of enzymes and examples. The properties of enzymes. What are the factors affecting enzyme activity like temperature, substrate concentration, Km value, very commonly asked Km value, Vmax. So competitive, non-competitive inhibition, glycogenolysis, not glycolysis, glycogenolysis and glycogen synthesis, glycogen storage disorders, GSD. Very important question. Can I name one glycogen storage disease? Can I name one glycogen storage disease? Come on. Commonly asked in RGUHS. Hepatomegaly, splenomegaly, hypoglycemia. What is that? Glycogen storage disorder. Come on, try. Yes, very good, Malini. One Gurke disease. One Gurke disease. Good. Dietary fibers. Very important, dietary fibers. Define dietary fibers. Uses of dietary fibers and examples. Examples. Very important. Enzyme inhibition. Competitive, non-competitive. Very important. Differences. Km value, Vmax. Buffers. Blood buffers, kidney buffers. Kidney buffers we discussed in physiology class. Fatty liver. What is fatty liver? What are lipotrophic factors? What are lipotrophic factors? Very important. Then comes is anaplerosis. What are the anaplerotic reactions and examples and the importance of that? So these 20 are my predictions in one class. You can just go through this. One Girke, very good, many answering. So that's great. That's great, all of you. That's really nice. So any doubt, you can ask me. Now I am free. You can ask me any doubt if you have. Yes, all are repeated questions. So Manthan, how is the preparation going on? Okay, Manthan. Okay, good. That's great. Yes, last 2 exams. But don't be saturated. You need to continue the same hard work. Same hard work for next 3 days and around 5 days. 5 days. After that, you can take 1 day break. So you can start reading for your practical exam. Okay. No, this is only half completed. We have one more session. So probably tomorrow. So that is also needed. Okay. So Manasa Yadav, don't get stressed. Do your best. Yes, Charan. All is well. I can do it. All is well. I can do it. I'll try my level best. Great. Positive, positive, positive. Okay, good. You all going to become good mentors in future. Especially Malini, Charan, Manthan. You're going to become good mentors. So once you adopt positive mindset, you'll become good teacher. You'll become happy man in the world. You'll become happy person. You will achieve whatever you wish to achieve in your life with the positive attitude. Nothing is impossible. Impossible is I am possible. Okay. Good, good. Yes, Malini. So was this class helpful? These classes basically anatomy and biochemistry, physiology we are doing since last 10, 12 days. So last minute preparation. So what is your opinion about it? Manasa Yadav, Manthan, Charan, you just tell me, is it really useful? Shall we continue? So what is the positive in that? You can just type. Yes, Manasa Yadav, great. Okay, Manthan. Okay, great. So many questions came in physiology, anatomy too. So many questions, right? Okay, so that's it about today's session. So thank you all. Happy reading. Keep studying. Keep studying till you get success. So what is important is accuracy, specificity. So that comes only with the revision. A revision, nothing but the revision. So more revision, so more knowledge. The more knowledge, success in life. So that is the funda. Nothing else. Okay? Thank you all. See you next class. Bye bye.